Felder. African immigrants make up between 17 to 20% of the district's foreign-born population. Although among the best educated and generally likely to report better health, African immigrants face major challenges in regards to access to health care. So the Mayor's Office on African Affairs has launched Think, Eat, Act, Move Africa, Team Africa. Ngozi Nmezi, Director of the Office of African Affairs, thank you so much for joining me.
Thank you so much for having me.
So I read over this and I thought, what a great idea, and it seems like a campaign to really engage your community.
That's precisely what it is. Think Africa is a culturally and kind of linguistically targeted campaign to ensure that the African immigrant community here in DC gains access to vital health services that help improve their quality of life.
And what you described, a lot of people deal with, so why specifically the African community as opposed to just the community in general?
Well, generally there are issues that the African immigrant community has to deal with, or issues, less issues, more barriers that affect the African immigrant community. Those barriers have to do with kind of cultural barriers, of course the perception of health and health care and health services, being able to access them, linguistic barriers, and then also just attitudinal barriers, kind of the thinking around how you're perceiving health services, how frequently you're supposed to get them, and just woven through all of that really is just kind of the challenges in understanding just different healthcare systems. You know, these are foreigners, this is a kind of a foreign land, so these issues and barriers are things that really kind of make it different for our community in terms of accessing healthcare.
What are you doing to engage the community to let them, one, know that this is available to them? So how are you letting people know, besides of course being on straight to the point?
I know this is precisely what I'm doing. This is all I'm doing. But so we've launched the Team Africa initiative, right? We launched it in February, and really for the past 3 months, what we've been doing is just engaging our community members around a multi-pronged approach that kind of encompasses the entire campaign that we're doing. So we've combined kind of a social media push, really highlighting the acronym THINK, really think about positive healthcare behavior, EAT, you know, eat more healthy foods, you know, smaller portions or kind of more healthy food choices, ACT, going out and getting screened, you know, and tested for specific ailments that affect our community, and MOVE, around exercising and really keeping active. So we've been able to promote that via social media platforms. We've also done a series of roving workshops in the community, really with the focus of actually taking the information, you know, to our community members, meeting them where they are. So we've partnered with faith-based organizations, community-based organizations,
which is so important.
Important. Like most people are really, I'm sure you understand the importance of that, but that's really how we find we are most effective in reaching our communities, taking it to where they are and partnering with these larger kind of institutions so that we're able to effectively reach that community. And then of course kind of culminating in this DC Africa Health and Wellness Fete that we're having on June 1st at Brightwood Education Campus. This is really kind of like all of the things that kind of encompass the larger campaign, and we've just really been working to make sure that our community members are aware of how we are culturally kind of targeting this, making it really relevant to the community, and really the interest that our administration has and just the overall wellness of all the district residents.
And do you find that there's one area, whether it's physical fitness or nutrition, is there one area that's harder than the other to get people to really understand this is why it's important, or is it certain health screenings? Have you found that there's one area that you need to concentrate on more than the other?
Well, I think that's an excellent question, and how I can respond to that would be around the roving workshops that we've done and the topics that we focused on in these roving workshops. So we essentially kind of presented a menu of topics, information topics to our community-based and faith-based organizations on mental health, on which is so important, on nutrition, and then just general kind of health literacy, which is more of a catch-all type of bucket. But what we were finding was a lot of mental health requests, right? I think it was the most popular workshop that was getting requested by by our community members. So I would say there's definitely a stigma, around mental health, and really just a different understanding of what it is and how it affects you.
I think that's wonderful. I I didn't mean to cut you off.
Yeah, no
just
worries.
because, you know, for so long, mental health, especially in communities of color, have been such a taboo topic to approach. But, you know, it doesn't mean that you're crazy or falling off the deep end. It just means sometimes you need help. You need someone to talk to. And I think that's wonderful in going out into community that you actually had people come back and say, hey, I need help. You know, how can you help me? How can I move forward? And I applaud you all for taking those requests and moving on it.
Definitely, it's super important. You know, and it is. I mean, if you're talking about acculturation and, you know, acclimating to a different land, moving, leaving your home country, coming, trying to settle, it's a lot, you know, for immigrants to handle. So I think it's an issue that definitely affects the African immigrant population in particular and immigrants in general.
Well, I also just want to talk about what you do in general with the Office of African Affairs.
Oh, sure. So just a little bit about the Team Africa piece and just some of the things that we were actually having at the site on June 1st that I think will be really exciting. There are African cooking demonstrations that are set to take place. Of course, kind of African-focused dance lessons and movements. So it's just important to kind of understand that there's a really kind of a cultural emphasis on what we're doing on June 1st. Aside from that, generally kind of the mayor of the District of Columbia really envisions DC as a community that thrives on the full engagement of its culturally, linguistically, ethnically, and socially diverse residents. So, you know, by and still, my office is here legislatively to ensure that DC government, or rather DC's African immigrant community, has access to specific district government services and beyond. So our general function is really to work to improve the quality of life of African immigrants and their children, ensure that they are civically engaged and participating in district affairs, and then lastly to really support community development by really building the institutional capacity of our community-based organizations that serve our most vulnerable constituents, and of course our business sector. Immigrants are 30%, very fledgling sector of immigrants here, immigrant businesses right here in the District of Columbia. We know that on a nationwide level, immigrants are 30% more likely to start a business than native kind of Americans. So most people are coming here to start business to fulfill the American dream. We really just work integrally with our community members to ensure that we are connecting them to services they need to be able to grow and thrive.
I think that's wonderful, and you hit on something that really made me think just now. You said someone is uprooted from their native land, they come here, they may have family or just a few people, and what do they do? And this is a wonderful way for them to join in and get active in their community.
Absolutely. That institutional presence, particularly from a government kind of optic, is so important. I mean, this office, the Office on African Affairs here in DC under the mayor's leadership, is really kind of the only office of its kind in the nation. So it's a wonderful kind of institution and support, you know, that it provides for community members that are, you know, coming here, newcomers or ones that have been here for quite some time. So definitely a wonderful way to stay plugged into different diaspora groups here.
Well, thank you so much for joining me. I applaud you for all the work that you're doing.